Good morning, students. Today we will see one topic that is breastfeeding that you already heard, learned, but we will see some more in detail. The breast changes which occur during pregnancy include size. In the size, there is increased size of the breast become evident even in the early weeks. This is due to marked hypertrophy and proliferation of the ducts because of estrogen and alveoli, that is because of estrogen and progesterone, which are marked in the peripheral lobules. There is also hypertrophy of the connective tissue stroma. Myoepithelial cells become prominent. Vascularity is increased, which result in appearance of bluish veins running under skin. Quite often, the axillary tail, that is the prolongation of the breast tissue under the cover of pectoralis major, become enlarged and painful. There may be evidence of stria due to stretching of the cutis. The nipples and areola. The nipples become larger, erectile and deeply pigmented. Variable number of sebaceous glands, nearly 5 to 15 in number, which remain invisible in the non-pregnant state in the areola, become hypertrophied and are called Montgomery tubercles. Those are placed surrounding the nipples. The secretions keeps the nipple and the areola moist and healthy. The outer zone of less marked and irregular pigmented area appears in second trimester and is called secondary areola. Secretions. Secretion can be squeezed out of the breast at about 12th week, which is first becomes sticky. Later on, by 16th week, it becomes thick and yellowish. The demonstration of secretion from the breast of a woman who has never lactated is an important sign of pregnancy. In later months, colostrum may be expressed from the nipple. After delivery, with the loss of placenta, circulating levels of estrogen and progesterone decreases, the level of prolactin increases. Colostrum, the yellowish fluid that contains more minerals and protein but less sugar and fat than the mature breast milk, have laxative effect is secreted for the first 2 days of postpartum. Mature milk secretion is present by third postpartum day. Breast engorgement with the milk, venous and lymphatic stasis and swollen, tense and tender breast tissue may occur 3 to 5 days of postpartum. Milk production and secretion. Milk is produced as a result of interaction between hormones and reflexes. During pregnancy, the glandular tissue is stimulated to produce milk due to various hormonal influences. Two reflexes mediated by two different hormones come into play during the lactation. The first one is prolactin reflex. Prolactin is produced by the anti-pituitary gland, which is responsible for the milk secretion by mammary gland cells. When the baby sucks, the nerve endings in the nipple carry message to the anti-pituitary, which is in turn releases the prolactin. The earlier the baby is put on the breast, the sooner the reflex is initiated. The more the baby sucks at the breast, the greater the stimulus for the breast milk production. Greater the demand for the milk, larger the volume of milk is produced. This is the prolactin milk reflex. The enhancing factors include sucking, expression of milk, emptying of breast, night feeds. The hindering factors include incorrect position, painful breast, prelactal feeds, and top feeding. Second one is the oxytocin reflex. Oxytocin is the hormone produced by posterior pituitary. It is responsible for the contraction of myoepithelium around the glands, leading to the ejection of milk from the glands into the lacteal sinus and lacteal ducts. This hormone produces a response to stimulation in the nerve endings in the nipple by sucking, as well as thought, sight, or sound of the baby. This is the oxytocin rejection, means ejection, milk ejection reflex. Sucking by the baby is the most important stimulus for the production and secretion of the milk in the mother. So when the infant sucks at the breast, stimulation of the nerve endings of the mother's nipple or areola sends signal to the mother's hypothalamus pituitary. Pituitary releases prolactin and oxytocin. The hormone travel via bloodstream to mammary gland to stimulate production and milk ejection, that is the milk let down. Again the infant sucks the breast. Lactogenesis. It means the milk initiation which occurred during the later weeks of pregnancy. Physiology of lactation includes 4 things. First is preparation of breast, otherwise known as mammogenesis, synthesis and secretion of the breast milk from the breast alveoli, that is known as lactogenesis. Ejection of milk is known as galactogenesis, and maintenance of lactation is known as galactopoiesis. Preparation of the breast or mammogenesis. Pregnancy associated with remarkable growth both ductal and lobular alveolar system that we have seen few minutes earlier. Second, synthesis and secretion of the milk from the breast alveoli. Even though some secretory activity is evident during antepartum period, milk secretion actually starts on third or fourth postpartum day. In spite of high prolactin level during pregnancy, milk secretion is inhibited due to high circulating levels of estrogen and progesterone. Prolactin, insulin, growth hormone, and glucocorticosteroids are the important hormones at this stage. The third one is ejection of milk. Oxytocin is the major galactokinetic hormone. Discharge of milk from mammary gland depends not only suction exerted by the baby during the suckling but also the contractile mechanism which expels the milk from the alveoli into the ducts. During sucking, a conditioned reflex is set up. Oxytocin is liberated from the posterior pituitary, produces contraction of myoepithelial cells of alveoli and ducts containing milk. This is milk ejection or milk letdown reflex, whereby the milk is forced down into the ampulla of the lactiferous duct, where from it can be expressed by the mother or sucked out by the baby. Presence of the infant or infant's cry can induce letdown reflex without sucking. Milk ejection reflex inhibited by factors such as pain, anxiety, breast engorgement, or adverse psychotic conditions. Maintenance of lactation or galactopoiesis. Prolactin appears to be the single most galactopoietic hormone. For effective continuous lactation, frequency of suckling is essential. Distension of alveoli by retained milk is due to failure of sucking. This is caused decrease in the milk secretion by alveolar epithelium. Ductal and alveolar distension due to failure of milk transfer is a cause of lactation failure. A healthy mother will produce about 500 to 800 ml of milk a day to feed the baby. It requires 700 kilocalories per day for the mother, which must be made up from the diet from her body store. For this purpose, a store of 5 kg fat during pregnancy is essential to make up any nutritional deficit during lactation. Types and composition of human breast milk. Type of breast milk include colostrum or otherwise known as early milk, transitional milk, and mature milk. Colostrum is produced the late stage of pregnancy till 4 days after delivery and it is rich in antibodies. Transitional milk produced from 4 to 10 days is lower in protein in comparison to colostrum. Mature milk is produced approximately 10 days after delivery until termination of the breastfeeding. The chart gives a difference between colostrum, transitional milk, and mature milk. Milk which outpoured in one feeding are classified as fore milk or early milk. At the beginning of the feeding or got more lactose, proteins, and water in the satisfy baby's thirst. Hin milk or late milk comes later on towards the end of the feed and is richer in fat content and provides more energy, satisfy the baby's hunger. For optimum growth, baby needs both fore milk and hin milk. Baby should therefore allow to empty one breast. The second breast should be offered after emptying the first one. This is the advantages of the baby because of the breast milk versus formula milk. So breast milk has more good things the babies need than the formula milk. Summary of a difference between human milk, animal milk, and the formula milk. This is the chart which gives a so there is no all the anti-infective factors and the growth factors present only in human milk. Vitamins, minerals are enough in the human milk, so it may be extra or less in the animal and the formula milk. The advantages of breastfeeding for the mother and the disadvantages of the artificial feeding. The advantage it provides perfect nutrients, easy digestion, protect against infection, helps bonding and development of baby, helps delay of new pregnancy. That means it acts as a contraceptive measure, protect the mother's health also. Dangers of artificial feeding: more diarrhea, chance of more diarrhea and respiratory infection, persistent diarrhea, malnutrition, especially vitamin A deficiency, more chance to get infection, overweight. Breastfeeding in the infant benefits. Scaling up breastfeeding could save the life of the mother than 8 lakh children under the age of 5. Breastfeeding associated with IQ increase in 3 to 4 points. Children who are breastfed for longer period have lower infectious morbidity and mortality rate than children who are breastfed for shorter period or who are not breastfed. Longer the period of breastfeeding associated with reduction in the child risk of overweight or obesity. The infant benefits are they get free from allergy, eczema, urinary tract infection, all these things. Provide immunological protection while the infant immune system is maturing. Breastfeeding the mothers. Breastfeeding would also prevent death of 20,000 women a year from breast cancer. Breastfeeding would also improve the birth spacing. Breastfeeding associated with reduction in the woman's risk for diabetes. Breastfeeding may reduce the rate of ovarian cancer. Benefit to the family and society. It saves money, promote family planning, decrease need of hospitalization, contribute to the child survival. Rules of breastfeeding. Exclusive breastfeeding for about 6 months and to continue at least second year. Complementary foods rich in iron and other micronutrients should be introduced at about 6 months of age. Mother and infant should sleep in proximity to each other to facilitate breastfeeding. Initiation of breastfeeding should be encouraged as soon as possible after birth, ideally within 1 hour. Ensure 8 to 12 feedings every 24 hours till 2 to 3 months, then feeding till 6 months, then 5 feeding till 1 year. At every feeding, the infant is placed only on one breast and then during the next feeding, the other one, thus alternating them. The duration of feeding is about 20 to 30 minutes. However, it is said that there is no exact time of every feeding of the infant. Every infant sucks the breast with different frequency and different duration of breastfeeding with a day. The amount of milk is the breast produce depends partially on how much baby sucks and how much milk he removes. More sucking makes more milk. Breast milk flow depends partially on the mother's thoughts, feelings and sensation. It is important to keep the mother and the baby together day and night and help the mother to feel good about breastfeeding. Give no supplements like water, glucose water, commercial infant formula or other fluids to breastfeeding newborn infants. Pacifier should be offered by placing the infant back to sleep position not earlier than 3 to 4 weeks of age and after breastfeeding has been established. Indicators of good attachment and positioning. The mouth is wide open, less areola visible underneath the chin than above the nipple, chin touching the breast, lower lip rolled down and nose free, no pain. Indicators of successful breastfeeding in the babies include frequent feeding 8 to 12 times a day, audible and visible swallowing, sustained rhythmic suck, relaxed arms with hands, moist mouth, regular soft heavy nappies, about 6 to 8 wet diapers per day, average daily weight gain 20 to 40 gram, go to sleep and comfort after feeding. Indicators successful breastfeeding in women include breast softening, no compression of the nipple at the end of the feed, women feel relaxed and sleepy. All the breastfeeding newborn infants should be seen by a pediatrician about 3 to 5 days of age to evaluate the hydration, to evaluate the body weight, assess the feeding and consider more frequent follow-up, discuss maternal infant issue, observe the feeding. This is the position of the mother. Proper position of baby while breastfeeding includes support whole baby's body, ensure baby's head, neck, back are in the same plane. Entire baby's body should be face the mother. Baby's abdomen touches the mother's abdomen. Correct positioning will ensure effective sucking and prevent sore nipples and breast engorgement. Attachment of the baby's breast. 4 signs of good attachment are baby's mouth is wide open, lower lip turned outwards, baby's chin touches the mother's breast, majority of areola inside the baby's mouth. Breastfeeding positions include first one is cradle hold. This is the most common position used by the mother's. Infant head is supported with the elbow, back and buttocks are supported by the arm and lifted to the breast. Second one is football hold position. The infant is placed under the arm like holding a football. Baby's head is supported with the forearm and the head is supported with the hand. Many mothers are not comfortable with this position. Good position after operative procedures. Sideline position. The mother lies on her side, propping up her head with shoulder with pillows. Infant also lying down facing the mother. Good position after cesarean section. Allows the new mother some rest. Most mothers are scared of crushing the baby. Cross cradle position, ideal for early breastfeeding. Mother holds the baby crosswise, the crook of their arm opposite the breast and the infant to be fed. The baby's trunk and head supported with the forearm and the palm. The other hand is placed beneath the breast in a U shape to guide the baby's mouth to the breast. And another position is Australian hold position. This is also known as saddle hold, usually used for older infants, not commonly used by mothers, best used in older infants with runny nose, ear infections. Storage of breast milk. Human milk can be stored at the room temperature for 6 to 8 hours. Express milk can be stored in an insulated cooler bag with ice packs for 24 hours. Breast milk can be stored in the refrigerator for about 5 days at the temperature of 40 degrees Celsius. It can also be kept in the freezer compartment of a fridge for up to 2 weeks. 0 to 5 degree Fahrenheit. It can be stored in the deep freezer for about 3 to 12 months. Beneficiaries, barriers to breastfeeding include individual inadequate knowledge, embracement, social negative perceptions. Interpersonal include lack of support from the partner and family, perceived threat to the father-child bond, institution return to work or school, lack of workplace facilities, unsupportive healthcare environment, community discomfort about nursing in public, policy, aggressive marketing by formula companies. Contraindications: infants, it is galactosemia, phenylketonuria; mothers infected with HIV. This is still a matter of debate. It is not sure, means it is not of very sure whether we can feed or not to feed the mother with HIV. Mothers taking any of the following medications like radioactive isotopes, cancer chemotherapy agents, antimetabolites, and illegal drugs. Breastfeeding mothers should avoid alcohol, and occasional drink is acceptable by breastfeeding should be avoided for 2 hours after the drink. Commonly mistaken as contraindications are the following: women who have cesarean deliveries, initiate breastfeeding immediately using a semi-recumbent position on the side of sitting up, women who receive vaccination or live with vaccinated children, neither inactivate or live vaccines administered to a lactating mother or the family members affect the safety of breastfeeding or for the mother or the infant. Women who had breast surgery breastfeed frequently to maintain milk supply. If the surgical wound is painful, the other breast can be used to but the monitor infant growth because the milk supply could be insufficient. Women who have hepatitis A initiate breastfeeding after the infant receives immune serum globulin and then vaccinate at the 1 year of age. Women who have hepatitis B initiate breastfeeding after the infant receives hepatitis B immunoglobulin and the first dose of the third dose hepatitis B vaccine series. Women who have hepatitis C, hepatitis C is not a contraindication for breastfeeding, but reconsider if the nipples are cracked or bleeding. Lactation failure, inadequate milk production. It may be due to infrequent suckling or due to endogenous suppression of prolactin by ergot preparations, pyridoxine, diuretics, or retained placenta. Pain, anxiety, and insecurity may be hidden reasons. Drugs to improve suppressions include galactogox, metoclopramide 10 mg TID increases the milk volume by 6 to 100% by increasing prolactin level. Sulpride, that is a dopamine antagonist, domperidone, have also been found effective by increasing prolactin level. Intranasal oxytocin contracts myoepithelial cells and cause milk letdown. Lactation suppression may be needed for the woman who cannot breastfeed for personal or medical reasons or the baby's IUD. The methods were commonly used as to stop breastfeeding, to avoid pumping or milk expression via breast support, ice packs to prevent engorgement, analgesics to relieve pain, and tight compression bandages applied for 2 to 3 days. Medical methods of suppression include the estrogen, androgen, or bromocriptine, not advised because of the high complications. Risk of breastfeeding. Breastfeeding is not without potential nutritional risk. The best documented risk include iron deficiency, vitamin D deficiency, breastfed exposed infant to environmental toxins, legal and illegal drugs, and infectious pathogens the mother may harbor, like human immunodeficiency virus. Mother's milk versus formula milk. A formula milk for 3 days old baby is not different than formula milk for a 3 months old infant. Breast milk is ingeniously different every single day, adapted to the changing need of the baby. Thank you. Thank you so much for listening.